Our next task is a vaginal discharge. Vaginal discharge. Let's look at an approach of vaginal discharge. So when you are faced with a vaginal discharge scenario, you have to ask about, of course, the nature of the discharge. Yeah, let's ask about the onset. Okay, so when did she notice the vaginal discharge? Was it a sudden appearance of the discharge or something that happened gradually? You're thinking about bleeding, the color of the discharge. Okay, remember the brown discharge sometimes may, suggest, bleeding. Any smelling, odor of the discharge, consistency. Okay, is it a thick discharge or thin discharge? Yeah, so we have to ask about the nature of the discharge. Then, after we've asked about the discharge, then we go to the differentials. So let's look at the discharge again. Did the discharge appear suddenly or gradually? And when did you first experience vaginal discharge? What is the color of the discharge? Is there any smelling? Is the consistency thick? Is the discharge thick or thin? Then the differential diagnosis. Common things include the bacterial vaginosis. This is a fishy, smelly, thin discharge, white grayish in color. There is no itching, no soreness in a bacterial vaginosis. The second one is vaginal candidiasis. It's a white, odorless, cady discharge. So there's no smelling, but usually associated with itching and the superficial soreness. So there is a soreness and there is itching in vaginal candidiasis. The color is whitish or gray whitish discharge. Now, if I'm going to go back, that gives you the same gray or whitish discharge in a bacterial vaginosis. But this is a fishy, smelly discharge. The candida discharge is not smelly. The bacterial vaginosis, there is no itching or soreness. Whereas in candidiasis, there is itching, there is soreness. Trichomonas. This is also fishy, foul-smelling discharge, but the color is different. Green, yellow, fourth discharge. So if they give the discharge of green, yellow, that is not bacterial vaginosis. It's a Trichomonas vaginalis. It may also be associated with itching and soreness and dysuria. So the white or colorless discharge, you need to think of either that is a vaginal candidiasis or bacterial vaginosis. Bacterial vaginosis, one more, it is what? A foul-smelling discharge. Whereas candidiasis is not smelling. There is itching in candidiasis because it's a fungal infection. There is no itching in vaginosis, bacterial vaginosis. Trichomonas, there may be itching, there may be soreness, but the color is a differentiating factor. Yellow, greenish, frothy discharge. Cervicitis or pelvic inflammatory disease. Okay, this is an infection. So the vaginal discharge, okay, may be foul smelling, may be associated with bleeding, either postcoital bleeding after sexual intercourse or intermenstrual bleed. There is the deep dyspareunia, that is pain during sexual intercourse. There will be lower abdominal pain because it's a PID. The discharge may be greenish, but it's usually foul smelling, and it may be chronic if it's a chronic PID. So looking at the common ones. Examinations, when there's a discharge, you need an abdominal examination. An abdominal examination, okay? That to check for what? Low abdominal tenderness, especially if it is what? A PID you're suspecting. Malignancy as well. There's so many things to rule out on abdominal examination. You need a PV examination. A PV examination, what you're going to find, you may find the gloves, discharge on the gloves. Yeah. Inspection of the vulva. Yeah. You may see ulcers. You may see redness or in other lesions. So you need an abdominal examination. We need a PV examination. We need a speculum examination to visualize the cervix and the vagina. Okay. To look for signs of what? Cervicitis, vaginal discharge on examination, or any foreign bodies such as tampons or condoms. Okay, so let's correct this one. The vagina. Yeah, fine enough. Good. We want to correct that one. Let's look at the next. What other examination we said? Sometimes you have to do testing. Yeah, test the pH of the vaginal discharge as part of an examination. In bacterial vaginosis, the pH is higher than 4.5. In Trichomonas, pH higher than 4.5. In vaginal candidiasis, the pH is less than 4.5. 4.5 or less. So candidiasis, you can differentiate the pH, 4.5 or less. Whereas Trichomonas and vaginalis and bacterial vaginosis, they are above 4.5 as part of an examination. Okay. Investigation. Now, when do you do investigation? If it's a classical bacterial vaginosis, don't investigate, treat. If it's a classical, vaginal candidiasis, treat, don't investigate. But sometimes, if the history is not classical, for example, there's a white discharge, but there is no itching, that's not a classical candidiasis, is it? No. A classical candidiasis, soreness, itching, white discharge. If I don't get a classical history, then I need to take a high vaginal swab. Okay. I also need a urine dipstick just to rule out a UTI. If it's a classical vaginal discharge, whitish, itching, that's a candida, we treat. If it doesn't resolve, then we can think of investigating. But if the presenting complaint is not very classical bacterial vaginosis, not very classical vaginal candidiasis, then we can say we need to investigate because it's not a very typical presentation. So you have to look in the exam, the situation. Let's look at the scenarios. Bacterial vaginosis and vaginal candidiasis. Bacterial vaginosis first. In this particular case, you're an FY2 in a GP surgery. A 30-year-old lady has presented with white vaginal discharge. White vaginal discharge. Now, this particular lady, she is here for follow-up. She had the cervical swab taken. She had cervical smear done. She had endocervical swab and high vaginal swab taken. Gonorrhea, chlamydia, normal. Cervical smear, normal. Gardnerella, positive. So it's a follow-up. It's easy for us. When you take a proper history, you'll find that she actually uses an IUCD for the last 2 years. Sometimes she uses a bubble bath. She has not had sexual intercourse with her husband for the last 2 months because she's embarrassed with the fishy, smelly vaginal discharge. Okay, it's a whitish, fishy, smelly vaginal discharge. Be careful with the Trichomonas, which is a greenish, copious discharge. Be careful when you take the history. So that is the history. The history the same as above as we discussed for all bacteria, for all vaginal discharge. Then you're going to come to examination. We need an abdominal. In this case, is normal. The PV examination, there's a white discharge on the gloves. But she would describe it's a smelling discharge. She has had to change her underwear several times during the day. Okay, so it is affecting her life. But in this case, the diagnosis is easy for us because she's for follow-up and the test already confirmed bacterial vaginosis, Gardnerella positive. So we're just going to explain the task. We tell you positive for Gardnerella, but it doesn't say bacterial vaginosis. It's you to know that Gardnerella is, of course, is bacterial vaginosis. Yeah. So bacterial vaginosis is overgrowth of the normal flora, overgrowth of Gardnerella. Okay. It is not a sexually transmitted infection. It's not a sexually transmitted infection. But sexual intercourse is just a risk factor to develop bacterial vaginosis, but it's not a sexually transmitted infection. Explain the risk factors she has. She uses an IUCD. It's a risk factor of developing bacterial vaginosis. Uses bubble bath or shampoos are all risk factors. Vaginal douching are the risk factors. So we explain at the time of the diagnosis, this is what could have contributed. What you're going to do for me? Advise to avoid vaginal douching, avoid the bubble bath, avoid using shampoo in the bath. These are risk factors of developing bacterial vaginosis. Treatment, metronidazole, 400 milligrams twice a day for 7 days. If you're persistent, what if it doesn't help, doctor? this particular lady, this particular patient has got an IUCD. So if it does not resolve after treatment with metronidazole for 1 week, we might need to remove an IUCD, because having an IUCD in place does make it difficult to treat the infection. We might need to remove an IUCD, treat the infection first of all, before, of course, the IUCD can be inserted back. Okay. And in that situation as well, where there's no response to metronidazole, there are some other antibiotics that can be used, like clindamycin, for example. Offer a leaflet about bacterial vaginosis. So the question, what if metronidazole does not work, doctor? Well, if it doesn't work in your situation, because you do have a coil in place, we might need to remove the coil so that we can treat this infection properly, and probably try different antibiotics because the infection has not responded to a metronidazole. But if you have got a coil in place, it may be difficult to treat some of the infection. Offer a leaflet about bacterial vaginosis. Thank you.